In 2020, we saw digital health move faster than ever before. But at what cost? How much do you know about the technologies transforming our world? Join us as we build our cyber consciousness.
Say this is like 2030 if we make it there. What do you think? Yeah, what do you think healthcare will look like? Will we, will it be fully tech integrated? Will we still have hospitals, and will we have, the decentralized healthcare system? Will we have virtual clinical trials? Will doctors still be doctors? Will pharma turn into tech companies? Will that be the future? And what does this picture look like for you?
You asked about decentralized health. I think in a place like Canada, we need that. We have a really high cost of delivering health because we are a small population spread across a massive landmass. We have this paradigm where we believe in equal access to all. How does that work for somebody in Toronto versus somebody in the Northwest Territories or Northern Ontario, or where you have population densities of just a few people per kilometer? They're medical deserts. We have areas in Canada that have virtually no medical infrastructure, no health infrastructure. The answer there is decentralized care. Where's the business case or the cost analysis on how many people you serve for every dollar you spend, right? And how can, and are there more efficient ways to create access versus just building more more hospital infrastructure? One of the technologies we're working on, aside from the scorecard I mentioned earlier, is we have a concept for an at-home clinic, essentially, right? All the sensors are cheap now. All the medical sensors, all the heart rate monitors, oximeters, thermometers, digital stethoscopes, blood pressure monitors. All these things are, they're relatively cheap these days, and they're highly accessible. We're looking at very specific scenarios where people are, they can't leave their home, or they have trouble leaving their home. They have chronic diseases where they need a lot of check-in. Maybe that's not a bad place to have an at-home clinic. A little station that you can talk to your doctor, get it basically, get your health metrics read out, and have a consult. And this can be navigated by the individual, by a healthcare companion, or informal caregiver, which is really your loved ones, your family and your friends who provide you, that provide us care, in addition to the doctors and nurses. Their value is almost equal in terms of work done to the actual formal healthcare system. And yet we provide no supportive technology or education to these people. That's a huge untapped resource that's not only willing and able, but is already engaged. And yet we do very little to potentiate and enable those people.
What you shared really hits home for me because, I grew up in Kapuskasing, Ontario. So I grew up in a remote community where, for me to see my rheumatologist, I had to wait 6 months. Where my father was getting his diabetes check-ins, he'd have a trailer, pulling in from probably Toronto, 10 hours away, and then taking his vitals and getting his updates, and there was just like that can't be the future. There's so many issues and inefficiencies and errors that happen in these centralized systems. And so I really just love the vision for the future that you painted.